Good afternoon, everybody. Happy Friday. It's June 26, 2020. It's 1 o'clock in the afternoon, and you've joined the CAF COVID Weekly Roundup. It's hosted by me, Jason Belden. I'm the Director of Emergency Preparedness for CAF, and we're very lucky today to have guest speaker Patty Owens. Patty is the Director of Regulatory Affairs for CAF. Many of you guys know Patty and you talk to her. She's actively involved in most of these AFLs, as well as helping folks through survey issues. So we're very lucky to have her join us today. I just want to mention one thing, a bit of housekeeping before we get started. Two separate things, just in case we don't get to them at the end here. In regards to when we do these webinars, next Friday is a holiday or an observed holiday. It's not a holiday for everybody, I understand, but what we're going to do is we're actually going to host this webinar directly following the HAI call next week. So if you normally pay attention to that call, our webinar is going to start directly after that. So 1 p.m. next Thursday, and then we'll do the webinar. We'll have a reminder at the end in case folks didn't catch that. And then if people have, we didn't, we had some great speakers last week, the Cal OSHA attorneys. We did not have a chance to get to questions from them. And I know that was a really important thing for folks. And I had a lot of questions about them afterwards. We had so much good feedback based on the information that they provided that most folks said they wanted even more, and they wanted to be able to ask the attorneys questions. So our plan is, CAF is having a virtual conference in July. Many of you guys are aware of that. I was planning on doing a session at the virtual conference regarding Cal OSHA, but these folks are much more steeped in it than I am. And so we're going to ask them to expand their program from a 1 hour kind of thing to 2 hours. That'll give us a lot of time to answer questions. So our hope is that they will join us for the conference. And if that's the case, I really highly suggest you guys, if you're going to attend the conference, attend that class, because it will have some interactivity. It's going to be done live, and we'll send you the date as quickly as we can. And one more thing to mention, on July 7th, there's going to be another webinar in regards to documenting costs and how you do that, the reimbursement for that, for the CARES Act money. But I'll give you the reminder and the link to register for that at the end. But I want to get to Patty. Patty's, like I said, been actively involved since the beginning of this response with all of these AFLs. And she's going to really dive in depth on reporting, waivers, AFLs, and then we'll talk about survey activity at the end. So Patty, thank you very much for joining us, and welcome to the webinar. Go ahead, Patty.
Well, thank you, Jason. And I'm really excited to be on this Friday call with all the providers. And a lot of you may have just seen come into your inbox right now. CDPH just released a brand new, spanking new AFL, which we're going to talk about a little bit on the next few slides. We have not had the opportunity yet to dive into it deeply and be able to send it back to you with our interpretation of it or the questions that we're going to be asking CDPH on it. And if anyone has any questions on it, and go ahead and shoot those questions to us. You can shoot them to Jason or I on the email, on an email, or on the CAF forum. Either way is fine. So we'll talk about that a little bit more. Okay, so first off, I'd like to talk about all the different kinds of reporting real quick. We were on the daily reporting. As you know, a new AFL was released, 2043, was released on June 19th. And part of the changes in that AFL were directly on the efforts of CAF. We were able to successfully advocate for our members on a few of the concerns our members had on conferring rights over to CDPH. Some of those concerns included login security, because any entity could have logged in and entered data for a facility, and having some type of confirmation page on the accuracy of what was submitted in your last report was what will be reported, a way to verify that our information was correct and secure, and before it was transmitted over to the NHSN by CDPH. So having said that, that AFL actually now covers those things. So hopefully that allows providers to have a little bit more comfort in that. Again, we're going to be talking about daily reporting. So again, in the AFL, it prevents unauthorized users from submitting a survey and allows facilities to view their most recent submitted survey. So that way you're able to correct any issues before it gets transmitted over to NHSN. So CDPH feels that hopefully that'll help providers feel a lot more comfortable. Again, their hope is actually in doing this for the providers is to help reduce the paperwork burden on providers and all this reporting that has to be done. So beginning June 22nd, facilities will need to log into the new COVID-19 Survey Hub, but of course, a lot of you have already chosen the option to do so already. The previous link to the survey will no longer be accessible on June 29th, and the new process, again, prevents the unauthorized users. And we've given you the link to make sure how to access the survey. We've had a lot of talk on the forum for the early achievers on getting their switched over to the new Survey Hub. The link wasn't quite working and this and that, and Jason was able to help navigate that on the forum for everybody, and I think we've gotten those issues worked through. If you have any additional issues with the link or anything to do with this new process, if you elevate that over to CAF, we will certainly make sure we bring it to CDPH's attention on your behalf. And of course, you can always work directly with the CDPH people as well. Facilities should continue to refer to the SNF COVID-19 dashboard frequently, because you're going to want to check your reported cumulative counts. Because again, making sure this information is available for the public, so you want to make sure it reflects the true picture of your facility. Okay, so this again is on CDPH baseline testing report. Oh, this is a new report. Okay, well, we all know that we have our testing report coming up. CAF has learned a couple things in some conversations with CDPH on seeking some clarifications, and we've learned that CDPH plans to add these testing reports to their CDPH public dashboard as well. And CDPH has also stated that reports that are not timely may raise a red flag, and that that may require CDPH to check in with your facility a little more deeper to see what's going on. So CAF suggests working with your district office on any facility-specific issues that may be complicating the completion of your baseline testing or the reporting and documenting of your facility efforts, and also to document them. Everything you do, you want to make sure you document your trail of all the efforts you're doing to make sure that you're being in compliance. Again, on the baseline testing, I've given you the link for the AFL in case some of you, have lost that along the communication chain with all the stuff that's being sent out. You have the deadline, June 30th, is fast approaching. However, if you have completed your testing already, please make sure you're sending your report in now to your respective district office and also to the CHQC email address as well. And you need to put in your subject line, it's really important that you put in your subject line, SNF baseline testing. That way they can quickly pull out that and make sure that they can verify your compliance with this AFL. Okay, so we've had a lot of activity, as everyone knows, on the NHSN reporting. We've had a lot of communication on the forum. We've been receiving a lot of phone calls from facilities. We've been trying to elevate all your issues and concerns over to CMS, and we're working with AHCA on that. CMS was issuing FA84 citations and CMPs for failure to report the COVID-19 data. And again, I just put on this slide what those requirements were. Let me go back one slide. I'm sorry. And again, you can look in your CASPER. These reports are being generated in the CASPER report. and you would need to go into the CASPER report to see if you have a citation. If you're not sure how to do that, of course, your MDS coordinator will know how to access that system if you need any help. And you're going to want to look there for multiple reasons, and we'll go to the next slide. This is just a little bit of background information that ACA sent out. These 2567s that are going to be showing up, they're auto-generated just based on configurations within the system that says whether you've reported or you've not reported. And the citations and the F884 citations, they're all going to have the same language. CMS is generating these automatically that have not submitted data starting with the week of June 1st to June 7th. That had started already. Many providers pointed out glitches or problems because they had reported. Of course, those issues were raised over to CMS. CMS will continue to review weekly if data was submitted and issue citations and CMP enforcements for facilities that it determines are not compliant. You're going to say everyone that's non-compliant will receive the same citation, and the language in the 2567 is the same for all providers. It does not specify what data was not submitted. It doesn't specify the dates, etc. So next, we had some ACA received communications from the Centers for Medicare and Medicaid Services regarding the NHN reporting. CMS is researching the issues that all the states have elevated over on the reporting system and getting citations that they shouldn't have gotten citations for, and making you be marked as non-compliant. CMS has reported that there are a few common issues they have discovered so far. So if you're not able to figure out what your issue is, maybe take a look at a few of these things. Facilities not entering the right CCN number. Facilities not selecting the right facility type. So this is just the common theme, may not be the exact for what's going on with yours, but facilities entering data after the Sunday deadline, but for the reporting week, and facilities entering data during the week, but for previous week's data. So those are the common issues they have seen. Of course, CMS is continuing to seek everyone's help to get these corrected and straightened out and pointing out any of these issues. They're looking into some actions that they could take to make it easier for those issues to be identified on the facility side of course, this platform. Steps that you can take now to ensure that your data is being uploaded correctly. This is just an overview. Check to make sure that your CCN number is correct. Check to ensure that your facility type is correct. Ensure that you are submitting data prior to 11:59 p.m. each Sunday. If you submit it after that, you are in non-compliance. That data does not go for that week, and you are out of compliance. So suggest you don't wait to the final hour to try to get this submitted and run into any glitches. That'll put you over that time frame. Data submitted should be new data since the previous submission. Do not enter cumulative data into the NHSN. You have to have a 0. You cannot leave something blank. If anything is missing at all, it won't be considered a complete report, and therefore it wasn't done. So you want to make sure that there's nothing blank. Okay, so we've received some good news, which is always nice. Some members have begun to receive notices in the CASPER. Again, this is mostly going to be communicated via the CASPER, and a lot of the citations have been rescinded. They're rescinding the F884 citations, CMS's, and the civil money penalties they were given for allegedly not reporting complete information for NHSN. So if you previously received a citation or an F884 for non-compliance, go back into the CASPER report, see if they issued a rescinding letter and if they've rescinded it. In the standardized format and frequency specified, okay. The letter indicates that due to its internal reviews of the NHSN data submission, CMS is deleting the F884 deficiencies and rescinding the CMP imposed for the June 1st through June 7th, 2020 reporting week. So look for those, and hopefully that'll clear that for you. These rescind letters may be sent through mail or through the CASPER, as with the FAA for citation, and enforcement letters may be accompanied by an email notification to the facility staff that have an MDS account in CASPER. So double check with your MDS coordinators, make sure that you guys are looking in MDS emails, the mail, or on CASPER for these sort of things. If you believe you successfully submitted your NHSN data and receive a citation and CMP in error, please check your CASPER folder for one of these rescinded letters. So that's really some good news there. CMS required weekly reporting. CMS has said a facility can question. Oh, also, this is also some pretty good news as far as, but it will take some work, and hopefully that if you did receive a citation, that it's been rescinded and you won't have to go through the IDR process. CMS has said the facility can question the cited deficiency through the IDR process by following the steps outlined in the notification letter that you received with the citation. They will give consideration to the facilities that have evidence showing they submitted the data or have been trying to register and submit the data, but ran into technical issues. So that's really important. And tracking. You can see why all your tracking is going to come into play now and in the future. CAF and AHCA will continue to advocate that CMS makes changes to have a more accurate and fairer process and give providers due consideration when the errors are due to the CDC, NHSN, or CMS. So we're constantly advocating on that at a federal level. In the meantime, you want to make sure you check your CASPER to see if you have a citation. If you have a citation that you believe is an error, then you should assemble the information needed to submit your IDR. CAF and ACA recommend putting together at least the following: a summary table of dates they started the registration process, you started the registration process, and all dates of the communication that you have had with CDC and NHSN. Screenshots if you have documented your data submissions, and begin taking screenshots of other verification evidence of each submission. Copies of emails sent and received from CDC and NHSN. Any other documentation of efforts you made to register and submit data, such as communication with the QIO or state. So again, that's going to help you to get those any citations that aren't rescinded resolved. Okay, so really quick, I wanted to talk about CMS. Again, CMS required weekly reporting via the NHSN. Okay, let's talk a little bit about conferring your rights to CDPH. Now, you can confer your rights over to CDPH at any time. I know the AFL had a deadline, but that was just for the initial reporting upload they were doing. If you've changed your mind at any point, you can confer your rights over. Do not confer your rights over to any other entities. We've had some issues where we've had to elevate some issues that were going on with LA that NHSN had automatically conferred some rights over to another entity that was reporting actually and putting data into, but mistakenly, into facilities NHS system. So members elevated that over to us. We were able to get that addressed immediately, of course, and the member was able to, they sent over the instructions on that facility on how to remove the rights from that entity to do such. CAF is working very closely with ACA to raise CAF member specific issues, concerns, and comments over to CMS. So continue to send us any of those things that you would like us to raise over to CMS on the NHSN reporting. And we've had a few conversations with CDPH. So of course, on clarifying questions on the behalf of our members, and CDPH upload for the week ending 6/21, last Friday, CDPH uploaded the SNF COVID-19 data to NHSN for 1,029 facilities for California. So a large amount of you have conferred your rights over to CDPH, which is hopefully working out really well for you. If you have any issues, again, making sure that you let us know. And we're really excited that's going to help you reduce your paperwork burdens. CDPH does not have the visibility in the NHSN data of those who have not conferred their rights. But CDPH does know that many of them that haven't conferred are reporting directly to NHSN. You've probably received phone calls if you hadn't conferred your rights and they wanted to know what your NHSN, they wanted to know what your number was because they wanted to verify you were in compliance with the regulation at a state level for the federal regulation. So they did seek verification that, from facilities on that. In addition, CMS has recently updated their SNF COVID-19 reporting website, and I've given you the website here on these slides, reflecting the NHSN data submission to CMS as a 6-7. Based on this website, a few facilities who received CMS 6-1 warning letters or CMS 6-8 penalty letters are now in good shape because CMS has since received their NHSN data submission for the week ending 6-7. So again, you'll most likely see one of those rescinded letters that's in your that you're going to receive in either your Casper at the Casper site or in the mail or your MDS email. Okay, so far there are 53 non-reporters as of 6-7. It's important to note that one of these 53 actually shouldn't be on the list, and because CDPH knows in fact that they've been uploading the data to NHSN, so CDPH is actually looking into with that facility what is going on under the NHSN side for that facility. Did they not do something in the enrollment process correctly, or is there a glitch specifically related to that facility? So in addition, 17 facilities have reported their data to NHSN via the CDPH upload by 6/21 and should no longer be considered non-reporters. So out of that, the remaining 35 are still outstanding. So for out of California, there's potentially still 35 still outstanding, and that may be because of issues you've been having in the NHSN system, communication with them getting back to you on your issues, but you have to again be documenting, if you're one of those 35, documenting very in detail all the things you've been doing to try to get to be in compliance with that reporting, and that should do those facilities well when they try to get these the IDRs done and get these citations removed. So good news, we're doing really well overall for California. Okay, so now I'm going to talk a little bit about CDPH waivers. As we know, we just had several, a waiver come in, but I really just wanted to talk first a little about the waivers that expire the end of June. Now we have AFL 2022.2 and we have AFL 2032. And in those AFLs, there's quite a few waived regulations revolving around staffing and what's the other one? I'm sorry, I drew a blank.
Visitation.
Visitation, thank you. That was the main meat and potatoes. And of the AFL, we were very excited that just came out. And then there's the waivers that expire at the end of the declared state of emergency. Those are, of course, are AFL 2035 and AFL 2040. Okay, so I'm gonna move forward. Oh, sorry about that, I meant to move. There we go. Okay, let's go back to the CDPH waivers. We were in conversations quite a bit with CDPH regarding our questions regarding these waivers coming to an end on June 30th. I know members have been getting a little nervous what's going to happen on June 30th. So the AFL that came out today is some good things in there with results for our members' questions and concerns that were elevated and over to CDPH. And that AFL just came out. Jason and I are going to be reviewing that AFL in great detail, and we'll be getting out our interpretation of it as well as any clarification that we may need from CDPH. So we'll be working on that over the weekend to make sure that we get that out to you. But it looks like it covers visitation, it covers staffing and things like that, the newest AFL that just came out. It looks like they're gonna, facilities that are COVID negative, they're gonna kind of be allowing the ombudsmans back into the facilities. with some, of course, screening and, of course, the PPE use, that sort of thing. And as our states open up, the biggest things that we can do, I think, with the Ombudsman Office is as a facility, you know, start your communications with the Ombudsman Office that's overseeing you, and kind of reach out to them and letting them know what your facility's been doing, because it's going to look a lot different now. Deanne pointed that out this morning. You know, they're going to walk into the facility and it's not going to be looking like the same facility that they were used to walking into. I mean, you're going to have different zones up. You're going to have residents that are now maybe located in different spots. And so you're going to be following all the requirements and the AFLs and the CMS memos, and your facility is going to look different and feel different. And that may come through, and also what they're hearing from the residents. So touching base with the Ombudsman Office might preemptively might be a good idea. Let them know what you've been doing in your facility a little bit, and that when they come in, they do come in for a visit, and they do start coming in as everything starts reopening up, what they can expect when they come in. Hey, when you come in, you're going to be screened. You know, this is what we expect when you go in and out of certain areas with your PPE, and when we expect it to be changed, and all of that. What zones they may be allowed in or not allowed in, and what it's going to look like for your facility might be different for each facility based on your mitigation plan and COVID-19 activity in your community. Jason, do you have anything?
Yeah, I just wanted to add something. The folks that work in the Ombudsman's office, we're going to address them at a state level and give them, you know, kind of confirm, you know, what the guidance is with CDPH and what that will look like for each ombudsman. So we'll approach it from a state level and have them pass out the minimum requirements that you guys have. But Patty's absolutely correct. If your mitigation plan is, and you have an active outbreak, there's going to be sections of the building, unless they've got full PPE, we should not be putting them in. And one of the main things that we're asking them is to have the ombudsman be tested prior to the entrance into the buildings, just like they would for any staff member that's going into a healthcare facility now. So we'll address those on a state level and have them, you know, kind of pass that information out to the ombudsman. But you're going to have to be the kind of gatekeeper to make sure that they follow those guidance. And I think once we create what the guidance is we want them to follow, we'll pass that out to you so that everybody knows what the kind of minimum expectations are.
Yeah, and what we've communicated at the state level with the ombudsman. Thank you, Jason. Yeah, and so it's going to look different for each facility, but there's going to be overall a general statement of what it's going to look like, and to help the ombudsman and the facility through this whole process. Next, other waivers. Okay, so we've received waivers, so many waivers from other entities. So one of the things that we do at CAF is we track a lot of things, and we make sure we're documenting things to help our providers moving forward. So we have created a waiver tracker. I've created waiver trackers for all the different entities that have waivers in place currently when they expire. The entire team has worked on, we have a tracker for everything that's come out related to COVID-19. And we have that color coded, that sort of thing. So we're really keeping an eye on what's out, what's currently out, and what's currently, what waivers are in place. So CMS has issued a lot of waivers. DHCS has issued a lot of waivers, and that's for other different types of entities. DHS has issued, of course, subacute waivers, and also there's some SNF waivers included in the CHA. CHA sent an 1135 waiver in as well, and because of the language in their waiver that was approved, it included all SNFs. So CDPH has definitely verified that the stuff included in CHA's waiver does include all California SNFs. So we had put out all this on the forum and in real time as they came out. So this is just like a quick recap. There's also some waivers from the California Department of Consumer Affairs regarding renewing licensing and that sort of thing. And then the Board of Pharmacy also has some waivers that have been issued through this whole thing. And most of these, of course, are retroactive date of March 1st through 2020 through the end of the declared emergency. So if anyone is wondering what any of those are, you can shoot me an email and I can send you anything you're looking for that way. Okay, well, let's talk about survey activity, because that's been a pretty hot topic lately. Everybody's noticing that, you know, CDPH is still being helpful in a lot of ways. They are definitely helping through the mitigation plans and getting us through the compliance with the reporting, and trying to provide a lot of education for our members. We do realize that some of these sessions we're having with CDPH sometimes can cause a little bit more confusion. So we want to make sure if you have any concerns or issues after listening to a session that you go ahead and get it clarified with Jason, Deanna, myself, or you know, or whoever's appropriate within CAF, so that we can clarify that question that statement that you might have picked up and wondering what they meant by that, or was that true or not true, and we can help you navigate that. On March 4th, there was a QSO 20-12 to all. CMS prioritized inspections to allow inspectors to focus on the most serious health and safety threats like infectious diseases and abuse. After that, on March 20, I'm just going to go through a couple of big ones. On March 23rd, we had QSO 2020 to all. CMS suspended certain inspections to increase the focus on preventing the spread of COVID-19. And CMS released a new infection control focused survey tool. We all know that. And this tool is also to be used for facilities for self-assessment and to assist with preparation and by inspectors during surveys, assessing facilities compliance with the federal inspections, infection controls and prevention requirements. June 1st, 2020, QSO 2031. This was a really big QSO, and there was a lot of stuff in there, and it was easy to miss a few things. And so this is one you may want to go back to and really take a deeper look at, because it's really speaking to a lot of the survey activity and how they want it to roll out. So in there, they also spoke to the quality improvement organization support. They are refocused the approach of the QIOs to assist in combating COVID-19 within these facilities. QIOs are being deployed to provide technical assistance to nursing homes, which includes a targeted focus at approximately 3,000 low-performing nursing homes across the United States who have a history of infection control challenges. Further, states may also request the QIO technical assistance in a specific facility, targeted facility, homes that have experienced an outbreak. So we've had some members that currently have QIO involvement. When they first started contacting the facilities really weren't sure what was going on and what they were supposed to do. So this QSO really dives into explaining these QIOs and what they are assigned by CMS to help facilities with. And you might want to take advantage of that and embrace that, because they're really what they're going to do is the QIOs are going to help nursing homes identify what their greatest areas of infection control problems are. Then they're going to help you create action plans and implement specific steps to establish a strong infection control and surveillance program in the nursing home. So this is going to be a really proactive help to help you identify these things, and this QIO is going to come in and help you do that and prepare you for when surveyors come in, so that you have really good systems. You're going to have better outcome for your residents, of course, and for your staff. And they train staff on proper use of personal protective equipment. They train staff on cohorting residents appropriately and transferring residents safely. They monitor compliance with infection control standards and practices in the nursing home. Now, California's QIO that's assigned to California, because each state has a QIO assigned to them. The QIO assigned to California is HSAG. So everyone's pretty familiar with HSAG. And so here's how the contact information for HSAG. Now, again, so if you wonder why their HSAG is contacting you, this is why. And it was really confusing for some providers because they had not read that particular detail in this QSO sent out by CMS. So it's actually a good thing. It's a helpful thing. It's going to get you better prepared. Okay, then we have, again, QSO 2031 on March 4th. CMS called for states to focus surveys in the same QISO we were just speaking about on the QIOs. The states to focus on the surveys on infection control, and on March 23rd, 2020, provided a streamlined tool for the facility's efforts. There is currently wide variation in the number of focused infection control surveys of nursing homes provided by the states. So between 11%, I don't know, I think that's a mistake on there. So I apologize for that. With a national average of approximately 54%. Based on COVID-19 nursing home data being reported to CDC, CMS believes further direction is needed to prioritize completion of the focused infection control surveys. So what this memo also did, it let each states know that they're going to be penalized if they don't meet certain benchmarks by certain times, and they're going to be penalized for this, and we'll go over that a little bit more, but this QSO covers that. Therefore, states that have not completed 100% of their focused infection control nursing home surveys by July 31st, and again, that's coming up. So if you haven't had yours, they have until July 31st to make sure all of this is 100% completed. Those states will be required to submit a corrective action plan to their CMS location, outlining the strategies that state has for completing these surveys within 30 days. So after the 30-day period, states that still not achieve the surveys when 100% of their nursing homes, their CARES Act fiscal year 2020 allocations may be reduced to up to 10%. And again, this is a penalty to the CDPH. Subsequently, 30-day extensions could result in an additional reduction of up to 5%. These funds would then be redirected to those states that had completed 100% of their focused infection control surveys by July 31st. So that they're trying to get the states motivated to complete these infection control surveys. Okay, also additionally in this QSO, in addition to completing the focused infection control surveys of nursing homes, CMS is also requiring states to implement the following COVID-19 survey activity. And I think we've all covered this. We know this. They're going to perform on-site surveys within 30 days of that memo of the nursing homes with previous COVID-19 outbreaks, defined as cumulative confirmed cases, bed capacity at 10% or greater, or cumulative confirmed plus suspected cases, bed capacity of 20% or greater, or 10 or more deaths reported due to COVID-19. So again, this is a really important QSO. Everyone really needs to understand where the survey activity is going to be coming from. It breaks it down into great detail in this QSO. I'm not going into all of the nitty-gritty details. There's a lot of information in that QSO. Next, they're going to perform on-site surveys within 3 to 5 days of identification of any nursing home with 3 or more new COVID-19 suspected or COVID cases since the last National Healthcare Safety COVID-19 report, or NHSN report, sorry, or one confirmed resident case in a facility that was previously COVID-free. State survey agencies are encouraged to communicate with their state healthcare association infection coordinators prior to initiating these surveys. So starting in fiscal year 2021, perform annual focused infection control surveys of 20% of nursing homes based on state discretion or additional data that identifies facility and common risk. Finally, to transition states, no more routine oversight and survey activity once the state has entered into phase 3 of the nursing home reopening guidelines, or earlier at the state's discretion. States are authorized to expand beyond the current survey priorities, were originally the immediate jeopardy, the focused infection control, and the initial certification surveys to perform for all providers and supplier types. So they're going to complete investigations that are triaged as non-immediate. They're going to start looking at these things. Complete investigations that are triaged as non-immediate jeopardy. High revisit surveys of any facility with removed immediate jeopardy, but still out of compliance. special focus facilities and special focus facility candidate recertification surveys, and nursing home and ICFs for individuals with intellectually disability, ICF-IID, recertification surveys that are greater than 15 months. So we've had a lot of questions on survey activity, so I really would point to looking at through this QSL. When determining the order in which is to schedule more routine survey, or states should prioritize providers based on those with a history of noncompliance or alleged or allegations of noncompliance with the below items: abuse or neglect, infection control, violations of transfer or discharge requirement, insufficient staffing or competencies, or other quality of care issues, example, falls, pressure ulcers, etc. So that's the priority. Then next, they're going to have enhanced enforcement for infection control deficiencies. CMS is going to post the health inspections survey results that were conducted on or after March 4, 2020, with its first date that CMS altered the way the inspections are scheduled and conducted. This included inspections related to complaints and facility reported incidents that were triaged at the immediate jeopardy level in the streamlined infection control inspection process, developed based on the guidance for preventing the spread of COVID-19. This information will be available in the Spotlight section of the Nursing Home Compare page, effective June 4th. So if you haven't looked there yet, make sure you look there to make sure that you're taking a look in the Spotlight section. Okay, so CDPH, infection preventionist education. We've heard a few calls with CDPH that, they really wanted to find out how they can help facilities be in compliance, how they can help facilities that are having trouble, where they're seeing over and over again the same findings, mostly centered around personal protective equipment use and really specific infection control practice issues. So CDPHs will be hosting a weekly Wednesday call now with SNFs, and they're hoping to have the infection preventionists on these calls. They had their first one yesterday, and so they just started and introduced what their intent with these education sessions. So that was yesterday. These meetings will be focused on the infection preventionist guidance, and it is recommended that SNFs infection preventionist staff attend. Local health departments and SNF administrators, director of nurses, and medical directors are also encouraged to attend. Jason, do you have anything to add at this point where I'm at?
Well, I want to give credit where credit's due. I think it's wonderful that they've expanded those opportunities for you guys to listen into that stuff. I think it's incredibly important, especially the Q&A session. When we advocate for you guys, when we talk to those folks, the decision makers at CDPH, a lot of times it seems like it's us making suggestions based on what's best for our members. And while that's absolutely true, we also care deeply about the folks that live and work in the buildings. And sometimes when we give them feedback, they don't necessarily hear what we're saying. And when you guys ask those questions on those webinars, it breathes life to those difficulties, and it puts them in difficult situations, and it makes them question whether the guidance is appropriate. And when it is, they answer the question unequivocally, and they answer the question without hesitation. But you can see when they, especially the questions about, do we have to retest residents after 8 weeks? We think that there are certain things about that don't make sense, and certainly the impact to retest somebody that's already come out the other side of COVID may be quite traumatic for them, as well as re-quarantining them if they remain persistently positive. So there are things like that when you guys ask those questions. And that's why I highly recommend that you guys get on there and ask the questions. Don't stop yourself from asking the questions. It's incredibly important. And that feedback helps them determine whether their guidance is achievable or not. So it's really important, guys. And I think it's highly valuable. Whether we agree with everything that's said on the webinar, sure, we have disagreements about things, but at least everything's out in the open. So highly recommend, if you don't do it, have somebody tune in, make this a regular part of your schedule. So.
Yeah, absolutely. They did this extra session because they realized on their normal Thursday call, their infection call, they didn't have enough time to get to everyone's questions. So they really wanted to have this provide another way for providers to ask more questions and really focus in additionally more infection control questions. So they really want providers, the people out in the fields doing the work, to have the opportunity to be heard, ask questions, and with the overall goal to improve our infection control processes in the facilities, because the only way to do that is to be open and ask questions, and to achieve good infection control practices. So the Thursday call will continue also. So I want to make sure I gave you that information. You want to make sure you're registering early for these Wednesday webinars because they're going to fill up fast. Space is very limited. Next, here you go.
I think we're at the end. That's perfect timing, Patty. It leaves us some time for questions. I just want to highlight the fact that you have to register through HSAG in order to get on the webinar. So there's a little bit extra layer to that. It's not a call-in thing. So make sure you get registered before the event, because it takes a few minutes to get registered. So we talked about visitation. Patty mentioned the new AFL today. Just from a cursory look, it looks to be fairly consistent with the CMS guidance. I'll have to take a deeper look at it, and Deanne as well. But we think our visitation guidance that we put in, and which we provided to CDPH, is a part of the basis that they use to develop this. We'll go over it, but my assumption right now is this is a good preview. So if you want to kind of look at what this looks like in terms of operationally, how you're going to do that, you can go onto the CAF website and download the visitor guideline if you've not. And then I just want to talk for a second about the quote unquote second wave. And we as a state are not out of the first wave. So I don't know what the second wave means, but we've seen a steady increase in cases in California, and that has not changed. It has not decreased. The infection rates and the hospitalization rates are actually, the infection rates are going up, but the hospitalization rates are going down. And so when you see these massive new numbers of testing, most of it has to do with the availability of testing. And we're finding, folks that we would not normally have caught before. And so that has a lot to do with the increase in numbers, but we really want to look at how many people are going to the hospitals. And those are the folks that are going to end up in SNFs. And when we talk about the second wave, we're looking at those folks that are coming out of the acute system into our buildings. Most of us in our mitigation plans put that we would have a staffing model that where we would dedicate staff specifically to the treatment of COVID care. Now, if you get a call from a hospital wanting to discharge one COVID patient and you don't have any COVID spaces, it's kind of in conflict with your mitigation plan, because the AFL previously submitted by CDPH has said that you cannot refuse admission solely on the basis of COVID status. But if that's a complete violation of your mitigation plan, if you put in that you will only take care of COVID people with dedicated staff. So as we think about this, we're going to see more and more ones and twos coming from hospitals rather than 20 or 50 or something like that. So we've got to really think about that. When you're talking to folks about your mitigation plan, look at what is that going to put you in? If you take one positive COVID resident, does that automatically remove your ability to take anybody else? And that's probably the main thing, because many counties have a standing order that if you have any COVID cases, you're closed for admissions. So I'm not sure what we're going to do with these folks. And frankly, it's something that we didn't really anticipate. I think our advocacy to the state is going to be that they need to really reconsider the thought of having centers or facilities that are set up for the post-acute needs of these folks. And then we've got flu season about 3 months away, and what is that going to look like for our residents? I've talked to a manufacturer of a product that is due to hit the market in September or October. It's called a Cepheid real-time PCR test. I think there are more of these out there, but it's essentially a CLIA waived instant PCR test that qualifies under the AFL, and I've confirmed this with the head of the testing task force. Now, these equipment are not inexpensive, but if you're a part of a chain, maybe it makes sense or pencils out to have these, because operationally it'll be a lot easier for you to do the testing and rule flu out at the same time. I think it's going to be beneficial to you. What the cost of the item is, I don't know, but we'll learn more about this. But in the next coming months, that might be something you consider. I mentioned the CAF webinar on accounting for the 10% and the federal COVID money. That'll be July 20th. We're going to have the virtual summer symposium. Some of the classes will be live and some will be on demand, which you can watch at your leisure. And then handouts for a list of links. I forgot to put the link to register in the handouts, but you have the handouts, and both the virtual conference and the registration for the webinar are on the CAF website. So with that, just one more reminder, next week's webinar will be on the Thursday at 1 o'clock instead of Friday at 1 o'clock, because Friday is an observed holiday. So if you guys want to listen in, just put a reminder that it's Thursday of next week. And with that, why don't we jump to questions, Courtney?
Hi there, can you hear me okay?
Yep.
Okay, great. So we have our first question. Regarding CDPH uploading to NHSN, there was an indication, maybe via AFL, that uploads would take place twice weekly. However, we have received sporadic notifications of upload via email. Last week, we uploaded to NHSN directly because we had not seen any notice and were concerned about getting fined. Do we know if the uploads will be regular and what days they will be?
I don't know.
Yeah, the uploads from CDPH, was that the question?
Yes.
Okay, yeah, we do. They're uploading them twice a week, actually. I did receive an email from CDPH on that. I don't have it in front of me, so I don't want to speak to what days of the week it's going to be, but they are uploading the data twice a week. I think it took them a little bit on their first round to upload the data, and they recognize that, but they fixed that with CMS. So for moving forward, they plan on doing it twice a week, and you're supposed to be receiving an email letting you know that the data has been uploaded and transmitted. If you haven't, it would be good to let me know in an email, and I can start elevating that as an issue over to CDPH, because they did say that they would, facilities would be notified when the data was transmitted over to NHSN, and that was supposed to be twice a week. So if that is an issue, and it's an issue over the next few weeks, you're not getting notified of that, I would need to know that, because if it's more than just one facility or two facilities, if it's a really a deep problem, something in their system that they're not aware, that it's not generating that notification, letting the facility know that it's been transmitted, then they definitely need to be aware of that. So I'll probably reach out today to CDPH and let them and see what I can find out on that for sure. They are aware of that.
Okay, thank you. Next question. How do we get the 1884 in Casper. I am in the CMS Casper report, but do not know how to get there. Thank you.
Well, I myself, I haven't had to navigate that because I don't, I don't go into there very often myself. So Jason, do you know, I'm pretty sure Dan would know that answer. Maybe someone that's while we're answering another question could type the what they've done to find it. Do you know, Jason?
I don't. And the problem with these things that makes it so hard is when we try to do the surveys to replicate what you guys are seeing, we can't do it because we can't get through the process without being an actual facility. And it makes it hard for us to counsel you on where to find it. But I will find the answer to that question. I'll get it from Deanne if she knows it, and we'll post it to the forum this weekend. Next question.
Next question. Yesterday on the CDPH call, they said to use the 10% medical increase to pay for employee testing. That 10% increase is for only 4 months and is being used for all these other extra costs. How is CAF advocating to assist members for employee testing?
Yeah, I heard that on the call yesterday, and certainly the money that was received from the federal government has to be used towards COVID-related expenses. But our advocacy and the guidance from DMHC has been that the health plans are responsible for paying for the ongoing testing. So theoretically, you should not be getting billed for that testing. If in your individual circumstance you have contracted with a lab that does not offer those services, one lab shop, find somebody that can do that for you, do the whole kit and caboodle all in one. They're doing the billing, the testing, and everything. That would be my suggestion. But if you're still running into issues, by all means, reach out to us so we can find out what's going on. But that's not been the guidance we've been given. Certainly, there will be providers that have uninsured folks, and the guidance has been there's an allowance to have them get on Covered California, and they've expanded the open enrollment period. I think that actually is coming to a close pretty soon. But so for even your uninsured employees, there is a method to get them insured, and which then would pay for the testing. But all our communication with the state around this has been that the health plans would be responsible for paying for it. So there's obviously a lot of holes in this, and there's folks that have out-of-pocket expense for one reason or another. My suggestion would be, expire all of those resources first, and then for anything that's left over, use any of the CARES Act money to cover the cost. And if that's not covering the cost, we need to know about that so that we can advocate for either more money or a more comprehensive plan for the testing. So, all right, next question, Courtney.
With shortages and expenses of PPE, who will pay for PPE for the ombudsman and families?
That will be the responsibility of the ombudsman to bring their own PPE. Now, that's if you guys have them and you feel strongly about, your facility policy is full PPE. We don't care where you're going in the building, and we have enough supply. By all means, you can do that. But our advocacy to them is because the supplies are so tight that we cannot pass them out. Now, if you individually as a provider have thousands of N95s sitting around and thousands of gowns sitting around, sure, you can do it, but it's not going to be something that you're going to be required to do. At least that's the way we understand it.
Yeah, and the AFL actually covered that the ombudsman will be bringing their own PPE, the new AFL that came out. And again, that's, you might want to make sure that you're, while the ombudsman's in the facility with their own PPE, it would be good for your team to be trained to know how to approach and talk to any entity in your building that might not necessarily be using the PPE correctly or changing it correctly. And so hopefully, as we navigate through this, we'll definitely be watching and these sort of things. But visitors PPE is definitely on the facility. Visitors won't be necessarily be bringing all their PPE. Most people have masks now, so that's probably not an issue.
Yeah, and with the visitors, we're we're not, I'm assuming the visitation, is not going to be allowed if you're in the middle of an outbreak. So, when we talk about what the PPE is going to look like for a normal visitor, not the ombudsman, it's going to be what we're doing for source control, that same kind of thing. That's my guess. I haven't read the AFL, but it's going to be less of a requirement. You're probably not going to put folks in full PPE. So that'll help a little bit. All right, I think we got time for one more question. Courtney, go ahead.
Okay, yes. I'm going to combine a couple questions here that I see about testing. So we've been waiting for our testing results despite the fact that we have the deadline of June 30th. The other question says, for example, we are still awaiting results from June 15th for some of our residents. Do you have any resources for more timely labs in California?
Outside of that, that testing task force lab list that they update once a week, I think it's last time I was updated was on the 18th. Outside of that, I don't. I only have anecdotal information from people that are using different services, but those ones I know that the state has vetted. If it's on that list of vetted vendors, each one of those vendors has committed to getting the meeting the timeframe goals of the testing. So we need to know about that immediately because the state has to follow up with that lab.
They
and
do,
either remove them because they can't meet the requirement, or it just depends on who the lab is. But I really feel like, if it's on that list of labs, I need to know about it immediately. So
what Jason would also, sorry about that, they also said, CDPH was saying on that they have let those labs know that SNF testing is to be a priority, so that they are aware of that's priority, the priority of the SNF testing.
Yeah,
and we let CDPH know if it's not.
Yeah, now I want to encourage you guys. I know we don't have a time to get to every question, and so much of that is really important for you guys, facility specific questions. Don't hesitate to reach out to me or Patty. We're happy to answer those questions. We'll triage it and see who has the requisite experience to answer the question. You can also do info@caf.org. That's kind of a generic mailbox. You're welcome to go back and re-listen to or re-watch that webinar from last week if you'd missed it. Those two attorneys, they scared us quite a bit with their presentation, but it was very information packed. So if you missed it, please check us out on YouTube as well. So with that, I want to say thank you, Patty. Thank you once again, Jamie and Courtney, for making all this technology work. And hopefully you guys have a wonderful weekend. Take care. We'll talk to you next week.